What's new? The National Epidemiological Surveillance System, SYNAVE, issued an alert due to the increase in cases of respiratory syncytial virus, RSV, during the 2023 seasonal period. The epidemiological statement highlights a rise in the incidence of other respiratory viruses, ORVs, especially RSV, affecting primarily infants under 1 year old, children aged 1 to 4, and those aged 5 to 9. So far, 463 cases classified as ORVs have been identified, with 63% of them linked to respiratory syncytial virus. Out of this total, 425 have required hospitalization, with 271 attributed to RSV. SYNAVE emphasizes that the entities most affected in terms of hospitalizations by this virus are the state of Mexico and Mexico City. As of now, no deaths have been reported due to this disease. In North America, the Pan American Health Organization, PAHO, has not issued any alerts regarding respiratory syncytial virus, RSV, indicating that the levels remain low with a slight increase. Mexico is not among the countries with the highest reported incidence. These cases are primarily concentrated in Argentina, 1,277, Chile, 813, the United States, 614, and Colombia, 481, with a positivity rate of 1.1%. In contrast, the countries with the highest positivity rates are El Salvador, 41.3%, Uruguay, 38%, and Guatemala, 31%. Essential information about respiratory syncytial virus, RSV. This virus belongs to the Paramyxoviridae family and is a quite common RNA virus. Transmission occurs from person to person through respiratory droplets or contact with objects contaminated by respiratory secretions from the affected individual. The incubation period of RSV ranges from 4 to 6 days after infection. It is important to note that infected individuals can spread the virus to others 1 or 2 days before showing symptoms. In the case of babies or individuals with compromised immune systems, they have the capacity to transmit the virus for up to 4 weeks after ceasing to exhibit symptoms. Symptoms associated with respiratory syncytial virus, RSV, include rhinorrhea, runny nose, hyperexia, reduced appetite, cough, sneezing, fever, and wheezing, whistling sounds during breathing. Typically, these symptoms do not manifest simultaneously or in all phases of the illness. In the case of infants under 6 months, symptoms may vary and include irritability, reduced activity, difficulty breathing, decreased fluid intake, and episodes of apnea. It is crucial to highlight that RSV is the most common viral cause of diseases such as bronchiolitis, pneumonia, and lower respiratory tract infections, leading to hospitalization of infants worldwide. According to the Centers for Disease Control and Prevention, CDC, children most susceptible to RSV-related illness include premature infants, those under 12 months, especially those under 6 months, children under 2 years with chronic lung disease or congenital heart conditions, children with weakened immune systems, and those with neuromuscular disorders. Here are some recommendations to prevent the spread of respiratory syncytial virus, RSV, and other respiratory diseases. Number 1. Stay at home if you have symptoms. Number 2. Ventilate closed spaces regularly. Number 3. Cover your mouth and nose when coughing or sneezing with a disposable tissue or your forearm, avoiding the use of your hands. Number 4. Wash your hands frequently with soap and water for at least 20 seconds. Number 5. Avoid touching your face without washing your hands first. Number 6. Maintain distance and avoid close contact with others, such as kissing, handshakes, and sharing utensils and glasses. Number 7. Clean regularly touched surfaces, such as doorknobs and mobile devices, frequently. Please comment on what you thought of the news, give the video a thumbs up, and subscribe to the channel. If you deem it necessary, you can share this video on your social media.